Good morning, everyone. My name is Faye from the Faculty of Medical Science, a third-year PhD student. And this morning, this section, we'll be talking about cervical cancer as a worldwide pandemic disease. But before I start, because this is a health-related topic, I might be using some words that might be provocative or offensive. And of that, I do apologize in advance. However, if you feel uncomfortable in any situation, just let me know. Okay? Now, moving on. I'm going to take you through the learning objective for this session, definition of what cervical cancer is, the causes, signs and symptoms, and of course, its preventive measures. I don't know, at the end of this section, you should be able to explain what cervical cancer is and identify the signs and symptoms, as well as recognize the preventive measures. Has anyone heard anything about cervical cancer? I don't know. Have you heard the word before, cervical cancer?
I thought it was cervical in here.
Okay.
Okay, cervical.
Yeah. So from my own side, here they pronounce it cervical, and from Nigeria, we call it a cervical. So that's why most times the accent is a bit of a problem, but we are all saying the same thing. So I'll go with your cervical. Does that make sense? More understood? Okay. So has anyone heard about that word, cervical cancer? Yeah? Show of hands? Have you?
Okay.
Yeah.
We have to explain it.
More like the female mostly have heard about it. Anyway, I don't blame them because it doesn't affect only women. So the men, you are exonerated. However, you might have a girl child, a mother, a sister that has a cervix. Okay, so cervical cancer is an abnormal growth in the linings of the cell of the cervix. And I actually need a pen to make a sketch. Okay, there is no pen. So I'll just show you a picture of what I mean. So, sorry. I assume that we all have seen a pregnant woman. Yeah? Mm-hmm. Good. So it's assumed that every woman has a womb, which in the medical term is called the uterus. And now, for the baby to move from the womb to the vagina and then out to the world, the baby needs to pass through something we call an opening, and that's called the cervix. Now, when there's an abnormal growth in those openings, they become cancerous, and that's how you get cervical cancer, which is a worldwide public health issue. So, causes of cervical cancer. I might want to ask about the cause, but since it's something that we don't really know about, I will just go straight ahead. Cervical cancer, one of the major causes is what we call the HPV virus, the human papilloma virus. And it's evidenced to have caused about 70 to 80% of the cervical cancer. However, there are some other things that can lead to it. Weak immune system, if maybe people that have HIV, tuberculosis, multiple sex partners, multiple pregnancies. Some places in my country, if you give birth up to 10 children, they kill a goat for you. So some of those things actually lead to cervical cancer, and previous family history. Before I talk about the warning signs, you've got a paper. Can you just go to the last part of that paper? So I've classified the warning signs into green, amber, and red. So just for a moment, you need to just think about some of the things that might be in the green sign. Now, what I mean by the green sign is, these are some of the signs that when you see them, they are also associated with other diseases. So it must not necessarily be cervical cancer. Amber in the middle, but then when you talk about the red, this is the danger zone. Now, that might not be a sign of cervical cancer. However, when you see some of those things, that should let you know that something serious is going on within your system. So just take a moment, look at your list. You can discuss with your partner if you want to, and just tick a box. If you think one of them should be under the green, under the amber, or red, you might as well just tick a box. If you think it's not applicable, it should not be a symptom, you can just click the white bit as well. Well understood? Yeah, feel free to discuss if you want.
I feel like with the doctor.
Yeah, we try. I know. Finished, you can raise your hand so I know. Okay? I have 3/8. If I get 4/8, that's a pass mark. It's quite a difficult one, but it's something that we all should know about. Some people are so scared of talking about it, but it's an important something we need to know. Okay, so if you have the lower back pain and some of this under the green, can I see? Okay. So some of us are health related, like we work as healthcare professionals and we do lots of hoisting and carrying patients and taking care of them. So you might come back having back pain. That does not mean you have cervical cancer, so relax. So it's just a way of letting you know that if it becomes persistent, then you should be thinking of something. And painful urination, it might be one of the STIs, sexual transmitted infection. So, but when you have all these things, you should be looking at it. So when you've got vaginal bleeding and you're not menstruating, I think that should be a serious sign now. When you've got blood in your urine, I mean, when you're peeing and you see blood, then that should make you understand that I think something is seriously going on. It might not be cervical cancer, but something might just be at the pipeline. So I'll just move to the preventive measures of where you have, so at this point, we'll just go to the pool.
So the pool is saying it's locked.
Yeah, I know.
Okay.
So here, I just wanted to, if you think, so it's unlocked now. So what are the preventive measures? Looking at that diagram there, what are some of the preventive measures, or what is the best preventive measure you think we should adopt in reducing the spread of cervical cancer?
All of them?
Yeah, you just click on the picture, play with your fingers, anesthetic learning.
So just one?
Yeah, just one.
Try refreshing the page. Oh, they're coming.
Okay.
Saw them there. Yeah, okay.
Just put the marks there. And then play results. Oh, you double clicked. Okay.
Clicked a lot. I thought that maybe my screen is not working.
Well, why you
So I
just
got all
doing
the
That's
work
fine.
files to be there. Like
But this
We're just gonna do it again. No worries. We're just gonna clear a response. Do you mind clicking again? So I think now you can click on your words.
Oh.
Yeah? You're just trying to find out for some reason why the percentage isn't coming on.
Yeah.
Okay, I'm just gonna move forward. Okay, so since it's not coming on the percentage for whatever reason, I'm just gonna ask, what do you think might be the best preventive measure in there?
Okay.
So, what did you
I
click on?
think it's all of them. Protections. Try to see if we do have this virus
Okay.
within us, and health education.
Yeah. What other suggestion? What do you think might be the best preventive measure?
vaccination and health education both.
Okay. Yeah.
Uh, healthy food, exercising.
Yeah. I mean, yeah, you're absolutely right. It might not be included in this, but they are all preventive measures. However, I'm just gonna take you through that. So health sex education, all these are preventive measures. However, male circumcision is not a preventive measure. And that's because there's a misconception, people thinking that if you have sex with someone who is circumcised, with a male who is circumcised, then the risk of having cervical cancer is reduced. It doesn't have any influence at all based on evidence. So that's why I clicked it out to say that it's not a preventive measure. So in case you clicked that, it's not a preventive measure. Before I conclude, I'll just take you to watch a short, very short video clip. I'm almost done, sorry. I just give you an overview of what cervical cancer is.
There's a disease that kills 3 women a day in the UK.
I was diagnosed with cervical cancer. I had 5 months of chemotherapy as well as a radical hysterectomy.
It's a disease that can shatter lives.
I lost my job, I lost my hair, and I lost my fertility. It was destroying. You can get a smear test before it develops into cancer and not have to go through what I've had to go through.
For more information, visit joestrust.org.uk.
It happened to me, and it could happen to you.
So that's just to let us know it could happen to anyone as long as you're a woman and you've got a womb. So conclusively, cervical cancer, there are 3 E's that I've just highlighted there. And so prevention, we say, is better than cure, which is why we advocate for early screening. And once you go for early screening, then the disease can be diagnosed early. It has 5 stages. And once you're being diagnosed early, that means you can get an early treatment. And when you do that, you help us prevent the spread of the disease and also cope for the developing countries where the tumor spread. You also help us prevent the spread of the disease and also let people know of what is going on. Thank you. So I don't know if you've got any question at all for me.
Dead on time.
Thank you.
Okay. I'll try and turn this off.
Yes, please.
Okay, thanks very much. Any questions for Faith on the topic before we reflect on her session?
I would like to understand, is it a cancer or is it transmissible?